It's very common for the irritating gases and the particulates in smoke to cause some health effects in even normal people. And that could be burning or itchy eyes, sore throat, headaches, a little bit of nausea. And that should really be a sign to stop what you're doing and get in clean air. The groups that are most susceptible to the health effects of wildfire smoke include the elderly or those over the age of 65, people with underlying health conditions like lung or heart disease, pregnant women, and infants. If you're a sensitive population, you may experience more severe symptoms and health effects, and that could include difficulty breathing or chest pain, and that would be a sign that you should call your doctor or go to the emergency room to get evaluated. Have a plan for what to do if the days get smoky. So really knowing where you can go to get safe air quality and what to do to prepare your home, and maybe talk to your doctor as well about what to do if you're experiencing any health effects. There are various things you can do to help improve the air quality in your home. That includes things like closing windows and doors. If you have a central air conditioning, putting your air on recirculate and making sure you have a good quality filter that will really take out those particles from the air. If you don't have central air, you can get a portable air filter, and I really recommend a HEPA filter that mechanically removes particles and doesn't generate ozone or other harmful byproducts. And then finally, you can make your own filter by using a box fan and putting a filter on top of it. So I know we've all gotten very used to wearing masks this past year for protecting us against COVID transmission. Unfortunately, those cloth masks that we use for COVID aren't effective at filtering out the smallest particles that are dangerous from wildfire smoke. You can consider doing things like wearing a tight-fitting N95 mask to help protect you. To be really effective, it needs to be, again, fit tested so it fits your face appropriately and really can filter out the particles and has a tight seal. As anyone who's lived in the Pacific Northwest over the past few years has experienced firsthand that wildfire seasons have become more extreme and are lasting longer. And most of the research to date has really focused on what are the short-term effects from breathing smoke. What we don't know yet is what are the health effects from these longer periods of smoke that accumulate over time.